In preparation for the operation, you should make sure that you're otherwise fit and well, no coughs or colds, and are not doing anything too strenuous in the week prior to surgery. I advise patients about avoiding over-the-counter vitamins and avoiding over-the-counter remedies, because some of these can actually increase bleeding prior to surgery. They should be well rested, and certainly in the last 2 days prior to surgery, well hydrated, and then have a preparation for the day of surgery. Small things like making sure on the day of surgery you're wearing clothing that doesn't need to be lifted over your head, and things that are buttoned up, so that it means that when you, after the operation, you pop the top back on without having to brush past the cast. And then making sure that there are certain things to buy that you'd expect to use after surgery. So cool packs, salt water washers, decongestants, all these will help prepare. Also, preparing for the recovery is important. So knowing the type of food that you should be eating and drinking after surgery is important. So I always tell patients to avoid things that are too hot or too chewy, as that might be uncomfortable when they've just had surgery. So preparing prior to the operation, making sure they're well and relaxed and prepare for the day of surgery, and then making sure they can prepare for the recovery, because straight after surgery it's quite difficult to run around and get all these things. So making sure you're preparing for recovery is essential too.